What difference does newborn screening make for CF patients? Imagine discovering a health condition early enough to make a real difference in a child's life. That's exactly what newborn screening for cystic fibrosis does. When a baby is born, a simple blood test is usually done within the first few days. This test looks for specific markers that might suggest cystic fibrosis. If the screening is positive, doctors will do further tests like a sweat chloride test, which measures the amount of salt in sweat, to confirm the diagnosis. Early diagnosis through newborn screening is a game changer. It allows healthcare providers to start treatments and nutritional support right away, often within the first few weeks of life. This early start helps prevent serious organ damage, especially in the lungs and pancreas. For example, children diagnosed early tend to grow better and gain weight more normally because they receive nutritional support before malnutrition sets in. Treatments can also begin sooner to help keep the lungs healthier. Children with cystic fibrosis are prone to lung infections caused by bacteria like Pseudomonas aeruginosa and Staphylococcus aureus. Starting therapies early can reduce the frequency and severity of these infections, which helps slow down lung damage. It also means children are less likely to need frequent hospital stays, which improves their overall quality of life. Research shows that children diagnosed through newborn screening tend to have better growth measurements and fewer respiratory infections compared to those diagnosed later when symptoms become obvious. Early diagnosis also means that pancreatic problems, which are common in cystic fibrosis, can be managed sooner, reducing the risk of severe complications. However, not all regions have the same screening protocols, and some cases might still be missed, especially in babies from diverse racial and ethnic backgrounds. That's why health authorities recommend improving screening methods to make sure every newborn can benefit from early detection. In summary, newborn screening for cystic fibrosis makes a vital difference by catching the condition early and allowing for proactive care. This early intervention helps children grow better, stay healthier longer, and live fuller lives. It highlights the importance of universal screening programs and timely, specialized medical care. Always remember, if you have concerns about cystic fibrosis or newborn screening, talking to a healthcare professional is the best step to get personalized advice and support.